Welcome to our video on the Ebola virus, a highly infectious and often fatal virus that is responsible for sporadic outbreaks in Africa. In this video, we will discuss the history, symptoms, transmission, and prevention of Ebola virus disease. History of Ebola. The Ebola virus was first identified in 1976 during simultaneous outbreaks in Sudan and the Democratic Republic of Congo, formerly Zaire. The virus was named after the Ebola River, which is located near the site of the first outbreak in Sudan. The outbreak in Congo occurred in a village near the Ebola River, and the virus was named after the river to avoid confusion. Since the initial outbreaks in 1976, there have been sporadic outbreaks of Ebola virus in Africa, with varying degrees of severity. The largest outbreak in history occurred in West Africa from 2014 to 2016. With over 28,000 confirmed cases and more than 11,000 deaths. Research into Ebola virus has led to the development of several potential treatments and vaccines, including the experimental vaccines. Despite this progress, Ebola virus remains a significant public health threat in Africa and around the world. About Ebola virus. Ebola virus is a member of the family Filaviridae and is characterized by a unique filamentous shape. The virus particle consists of a long, thin filament that is about 80 nanometers. The viral genome is a single-stranded RNA molecule that is approximately 19 kilobases in length and encodes several viral proteins. The viral envelope is studded with glycoproteins that are responsible for mediating attachment and entry of the virus into host cells. Ebola virus is classified into several different species, including Zaire Ebola virus, Sudan Ebola virus, Bundibugyo Ebola virus, Thai forest Ebola virus, and Reston Ebola virus. These different species of Ebola virus vary in their genetic makeup and pathogenicity. Risk factors of Ebola virus transmission. Factors that increase the risk of contracting Ebola virus disease include exposure to infected individuals. Ebola is transmitted through direct contact with the bodily fluids of an infected person or animal. This can include blood, saliva, urine, semen, breast milk, and feces. The virus can also be transmitted through contact with contaminated surfaces or objects. Healthcare workers and family members caring for sick individuals are at the highest risk of contracting Ebola. Funeral practices. Another risk factor for Ebola virus is participating in funeral practices that involve touching the deceased. In many African cultures, it is customary to wash and dress the deceased before burial. This can put family members and other individuals at risk of contracting Ebola if the deceased was infected with the virus. Poor sanitation. Poor sanitation and hygiene can also increase the risk of contracting Ebola virus. Lack of access to clean water, proper sanitation facilities, and appropriate waste disposal methods can lead to the spread of the virus. Geographic location. Living in or traveling to areas where Ebola virus is endemic is also a risk factor for contracting the disease. Ebola outbreaks have occurred primarily in Central and Western Africa. Symptoms of Ebola virus. The initial symptoms of Ebola virus disease are similar to those of many other viral infections, including fever, headache, and muscle aches. These symptoms can appear within 2 to 21 days after exposure to the virus. Gastrointestinal symptoms. As the disease progresses, individuals may experience gastrointestinal symptoms such as vomiting, diarrhea, and abdominal pain. These symptoms can lead to dehydration and electrolyte imbalances, which can be life-threatening. Hemorrhagic symptoms. Some individuals with Ebola virus disease may also experience hemorrhagic symptoms, such as bleeding from the eyes, ears, nose, or mouth. This is due to the virus causing damage to blood vessels. Neurological symptoms. In some cases, Ebola virus can also cause neurological symptoms such as confusion, seizures, and delirium. These symptoms can be particularly dangerous and require immediate medical attention. Late-stage symptoms. In the late stages of the disease, individuals may experience severe organ failure and shock, which can be fatal. How Ebola virus can be prevented. The measures that can be taken to prevent the spread of Ebola virus disease include: practice good hygiene. One of the most important measures in preventing Ebola virus is practicing good hygiene. Regular hand washing with soap and water or using an alcohol-based hand sanitizer can help reduce the risk of infection. Personal protective equipment. Individuals who are caring for sick individuals or who are in close contact with individuals who may be infected should wear personal protective equipment, such as gloves, gowns, masks, and eye protection. Safe burial practices. In many African cultures, it is customary to wash and dress the deceased before burial. However, This can put family members and other individuals at risk of contracting Ebola if the deceased was infected with the virus. Safe burial practices that involve the use of personal protective equipment and avoiding direct contact with the deceased can help prevent the spread of the virus. Avoid bushmeat. Ebola virus is believed to be transmitted to humans through the consumption of infected bushmeat. Avoiding the consumption of bushmeat and ensuring that meat is thoroughly cooked can help reduce the risk of contracting the virus. Vaccination. Currently, there is a vaccine available for Ebola virus. Individuals who are at high risk of exposure, such as healthcare workers and individuals living in areas where the virus is endemic, are encouraged to get vaccinated. Treatment of Ebola virus disease. Currently, there is no specific treatment for Ebola virus disease. However, supportive care can be provided to manage symptoms and improve the patient's chances of survival. Conclusion. In conclusion, Ebola virus is a highly infectious and often fatal virus that can cause severe symptoms in infected individuals. The virus is transmitted through direct contact with infected bodily fluids. Prevention measures involve avoiding contact with infected individuals and practicing good hygiene. It is important to remain vigilant and take necessary precautions to prevent the spread of Ebola virus disease. Thank you for watching this video on Ebola virus. Stay safe and healthy.